The bite tabs are heated on the maxillary side, placed in the patient's mouth, and indexes are made as previously described. Have the patient close together. One can then estimate how much extra compound will be needed by looking at the gap in the anterior area. It is then a simple matter to heat up more compound, place on the anterior bite tab, and test in the mouth again. The goal is to have a stable tripod as with the foam. Oftentimes, it needs to be adjusted by cooling and reheating so the stability of the bite fork can be demonstrated. Again, the clinician will know if the assembly is secure because the maxillary stops will not separate from the teeth when the bite fork is wiggled up and down. There are other methods of securing the bite fork assembly. Compound without using any of the tabs has already been mentioned. It would still require adhesive. Also, using polyvinyl bite registration materials such as Regisil, Vanilla, or Voco could be applied with certain provisions. It is important to make sure that the bite fork assembly has the registration material wrapping around the outside edges to secure it as well as using the adhesive. Lastly, it is important to make sure the bite fork is positioned parallel to the maxillary arch. Using base plate wax is also another option, but it would require holes being drilled into the bite fork so that the wax would not slip.